We'd like to acknowledge a community partnership near and dear to us that has developed over the past year. The Arizona Commission for the Deaf and the Hard of Hearing has taught us so much on our journey to provide accessible healthcare education to all Arizonans. They played a huge role in our success of our fully accessible health equity conference that we at OSHA put on earlier this year. And they provided guidance and expertise to us in writing and in communications, and they connected us with the lovely mothers who you are going to meet here today, who are going to talk with us in our next session. We're happy to welcome Carmen Greensmith from the Commission, or the Arizona Commission for the Deaf and the Hard of Hearing, or the Commission as we call it, to the stage to share a bit about their organization and to introduce our next speakers. Welcome, Carmen.
So, on to the introduction of these beautiful ladies who are with us today. Today, we have with us Joline Gregory, Trudaline McNeese, and Lexi Thompson.
So I'm actually going to be speaking today. Yes, I am deaf. There's so many different types of deaf people. Some of us can speak. Most of them can, or they don't want to. There's so many different types of deaf people. I'm going to try and speak as clearly as I can. I apologize if you don't understand me. So my name is Lexi, and I'm a mom of one beautiful little boy. He's also deaf, and he has bilateral cochlear implants. My two stories that I will be telling you guys today, one is going to be kind of a traumatic, heartbreaking story when it comes to inaccessibility to communication. And then my second story is going to be a beautiful story about a wonderful interpreter that I had during my son's surgery. So I'm going to start with the traumatic story, I guess. Actually, I want to explain a little bit about VRI, because all three of us, I'm assuming, will also be mentioning it. VRI, you guys have probably seen it in medical offices. It's called Video Relay Interpreter, or Interpreter. And it's going to be like a screen, normally a tablet or a laptop, on like these IV stands that rolls around. I'm also pretty sure that all of you guys have experienced that disconnect or the microphone issue that I see all these head nods. So VRI was meant to be in a corporate setting, meaning in a business room, on the same table with everybody around. It was meant for that type of setting. People who made it kind of go, oh, we can actually put it in healthcare. It is good, but there's so many issues with VRI, trying to connect to the interpreter, microphone issues, speaker issue, the little blurriness of the videos. That's not really access to communication right there. So you'll be hearing VRI throughout our speeches. I'll go ahead and start with my story. So in 2020, that was the year of COVID, right? Do you guys remember when Arizona went into a statewide lockdown in like March or something like that? I actually found out I was pregnant with at-home pregnancy tests about a week or two after lockdown. So can you imagine my stress levels? Like, So not only that, we had actually used every contraceptive and protective method possible. So this was like a surprise baby. So between a surprise baby, COVID, and then trying to find an office that would accept someone that didn't have insurance, because I was a non-essential worker, so I lost my job on top of it, so I didn't have medical insurance. And come to find out, when I finally found an office that accepted someone that was willing to pay out of pocket, they actually told me no to an interpreter because they were only allowing one person in the room with them. And I said, but I understand that this is a person, but they are a worker. They are my communication. This is how I understand you. So I actually got denied an interpreter during COVID. Let me put that over here. During COVID because of all the rules. So that was very, very stressful. But at least I found out I had a viable and healthy pregnancy. I did not know how far along I was prior to this appointment. Did not get an interpreter for the first 2 or 3 appointments, so that was a very, very rough year. Skip ahead to the birth month. So in December, I had given birth to him. It was actually a scheduled induction. My doctor, my OBGYN, throughout the entire pregnancy was amazing. For getting in-person interpreters, not VR. She even had masks that had these windows that you can actually see their mouth to be able to lip read. It's not a 100% cure or a solution. It helps though. So she had that. She literally went above and beyond. So my OBGYN was amazing, so keep that in mind. We scheduled an induction for me at 39 weeks at a specific hospital, I won't name it. The hospital was supposed to continue on from her work of trying to get an interpreter, accommodation, this and that. And keep in mind, this was the year COVID, 2020, everybody was still wearing a mask. Then they had these face shields, the plastic face shields, you can barely hear each other through those, let alone trying to speak through an interpreter or VR. And then the hospital did have an interpreter at the beginning when I got my Peterson for the induction. But then all of a sudden, the interpreter disappeared. This was not the interpreter's fault, by the way. Come to find out that all of a sudden I'm sharing an interpreter between myself and another patient on a different floor in the same hospital that may or may not have COVID when I'm trying to give birth to a baby on the same day. So that was kind of like, yeah. Then they actually offered or brought out the VI. Can you imagine trying to change plans on a mother that's in labor? Not a good thing to do. So they brought out the VI. I said, I want an interpreter because not only can the interpreter on the VI not being able to hear you guys through all those masks and plastic shields and stuff, I ended up interpreting for the interpreter to the doctor, being like, the interpreter can't hear you, can you please speak up? But if I was a deaf person that couldn't speak for myself verbally, I can't even imagine being in that situation. That's awful. And then the next thing was, a little bit of a mind fog. Oh yeah, so the interpreter showed up. It was a different interpreter. She showed up with the epidural. Amazing interpreter, but the epidural was only 10, 15 minutes. Amazing interpreter. And then she had to go help the other patient again. Is that okay? As long as I have someone here during the actual birth, because all of these staff in the room was trying to communicate with me, trying to make sure I was okay. I was starting to have complications. Every time I was comfortable, the baby wasn't. Every time the baby was comfortable, I wasn't. His heart rate kept failing. My heart, it was back and forth, teeter-tottering on a seesaw. My fiance, the baby's dad, was also there. However, he is not a licensed interpreter. He was just starting to learn ASL during that time. Beginner's ASL is pretty good communication-wise, but imagine all the medical jargon that you have to tell the patient. Trying to get a father who is about to have a baby, trying to sign this to a wife or a fiance that he's trying to console. So all of those issues kept happening. The interpreter came back again. It was a different interpreter, by the way. It was close to labor time. I was eight. And come to find out it was a male interpreter. I was already on my back, my legs were up in the stirrup. I have no problem with male professionals, don't get me wrong, no problem with male professionals. However, I'm very close to the majority of the interpreter community that I did not want someone I may possibly know to walk in and see my hoo-ha in the air. So, yeah, I was like, no thank you, but thank you for getting interpreted, but no thank you. I was already done, just done at that point. I went from 8 to 10 within a matter of 5 minutes, and he was out in 2 pushes. It was that fast. Right before that, though, I kept going in and out of consciousness. Every time I had a contraction, I went blind. Like, my eyes were closed, I would just go blind. Every time I had a contraction, my eyes just needed for visual language. Like, so that was kind of a... They almost had to put me in for a C-section, an emergency one, because of our heart rate teeter-tottering. I think my OBGYN went in and turned the baby around because he wasn't in the right position at 8. Turned the baby around, and that's when he just came right out. So that whole experience was just awful. And I had originally wanted 2, maybe 3 children. I don't even want another natural birth child. I might actually end up adopting one day. But that experience right there just ruined me wanting to get pregnant again. And it's just, like, I'm even shaking a little bit right now. It's super important to make sure that your patient has equal access communication for the comfort of not just the patient, but for everybody involved. It was a really bad time. I ended up having postpartum depression, postpartum anxiety. I actually even had a little bit of a disconnect with the baby, as in to the point where I still couldn't believe the baby was mine because of the trauma of it all. There was a lot more details of the childbirth, but I don't have that much time to get into it all. But I hope that hearing the cons and negatives of not getting that communication, of not getting what a mother should be getting to be comfortable during that birth, I hope that makes you feel, understand that. So that's the traumatic story. I want to go over to the good story. The good story is about my son. When he was 1 year old, he had bilateral cochlear implant surgery. Actually, it was a month after one. And the interpreter, this hospital was amazing. The interpreter showed up in person, no VI, and she was there from the beginning to the end. Super friendly woman, amazing person. She made me feel so comfortable and calm and happy throughout the entire appointment, pre-op, post-op, even during the operation. Every time someone came out to ask a question, she was right there. Obviously, she was a certified interpreter, but she was also I think she had certifications in medical interpreting. Correct me if I'm wrong. But she was very good with her medical jargons and interpreting that to me. I never felt like I was lost or I didn't know what she meant or what she was trying to say. It was such an amazing and beautiful experience during such a big surgery, in my opinion, that it was just a great experience. And that is the night and day difference between equal access to communication. If you can, try to advocate for in-person interpreters. They really do make that big of a difference. The eye is always usually going to have internet issues. I'm sure you guys have tried to be on your phone at some hospital or doctor's office and you can't even connect, can't even call, can't even video chat, can't even send a text message. It's the same thing with the eye. So I think that's about it. Just try to advocate for people to get in-person interpreters. Just try to remember that VRIs can make everything a little bit more anxious and aggravating. And I think that's all on my end. If you have questions, though, try to wait until the end of all 3 of our stories. I'm super open to questions, and I love answering them. So that's all on my end. You ready?
All right, I think I'm going to stand up. I feel more comfortable standing. All right, sorry, I'm very pregnant. Hello, everyone. My name is Trudaline, and I'm really honored to be here. Thank you for inviting me to talk about my experience with childbirth. I had 2 vaginal births, and this is my 3rd child due September 26th. It's going to be induced. I want to add that I'm high risk for all 3 of my pregnancies and births, and I have health issues, hypertension, diabetes, and now because of my age as well. I have some good experiences, and I have some unfortunate experiences as well. I'll start with my first birthing experience in 2014. I was a new mother at the time, and I asked for an interpreter, and I was told that the policy is that you have to be admitted first, and then at that time they will coordinate interpreters afterwards. I didn't know the process or what to expect at the time. I didn't fight or advocate for myself or complain. I just accepted it. I wasn't crazy about the VRI systems. So I had the baby, and VRI was okay at the time, and they had a live interpreter, an in-person interpreter show up, and I asked if I could have an in-person interpreter until the baby was born, and then the interpreter could go home. They said, well, no, after the baby is born, then the interpreter can go home, and then you will use VRI from that point on. At that time, I didn't know what my rights were. I was just learning, first time being a mother. I had the baby, and induction, it was an induction birth, and I was tired. The baby was born at 2 in the morning, so I was exhausted. The VRI system worked fine. The interpreter went home. So at that point, I was using the VRI system, and I was dazed and groggy until about noontime the next day. The VRI system stopped working. So I had no VRI, and I asked for an in-person interpreter at that point because the doctor was coming, listening to the doing baby tests, or actually hearing tests on the baby and other tests. And so I wanted to have that information in real time. They said, well, you have to use VRI. We can't have a live interpreter for you. And he was talking directly to me. I was tired, exhausted, confused. And I said, please turn on the VRI then, please. And I'm not good at lip reading. They insisted that I lip read. I can talk a little bit, but I'm afraid of misunderstanding with lip reading. But they insisted. I was tired and exhausted. I didn't know what to do with my baby. I'm a first-time mother. Really a horrible experience. I hope I never have to go through that again. For my second child, for my second birth, that happened in 2018. And that was an amazing experience. As I mentioned, when I asked for, it was an induction scheduled 2 weeks in advance, and I asked for an interpreter ahead of time. They said, no, sorry, that's not how our system, just like the first time, that's not how we work. You have to be admitted first in order to get an in-person interpreter, so you'll be using VRI for a while. I insisted that I wouldn't do that. I'm not going to go through that same experience as the first time. And I was induced at 36 weeks for my second child. The first child was 38. So 36 the second time. I was afraid, what if there were some complications? How would I communicate through the VRI system? So I was very worried about that. And they said, no, can't do it, sorry. That is our policy. That's hospital policy. And so that made me very upset. Fortunately, my new OB doctor was familiar with my first experience, and I made it clear that I was afraid that this would happen again. They made sure it wouldn't happen. So they went ahead and scheduled an interpreter for me under their clinic, meaning their clinic paid for that. Usually the hospital's responsible for that, but the clinic paid for the costs of an interpreter, and I tell you, I had an interpreter from the very beginning until the time I was sent home. And my daughter had to stay in NICU, And what happened is when I had my daughter, they took my daughter and her lungs were not fully developed. She had what was a grunt, and the baby's father at the time was deaf too. So the interpreter who was assigned to me, there was some confusion. They took the baby off immediately because of that, and the interpreter asked me, "What do you want me to do?" I said, "Well, I'm getting stitched right now, so I can use the VRI. So you go with the baby's father and interpret for him." Imagine if I only had the VRI system, though. That wouldn't have happened. If VRI was the only option, then I would have been paranoid, not knowing what was going on, feeling stressed out at this time. But I had an in-person interpreter where I could delegate and have him go to the emergency, and I could use the VRI in that case. So it really enhanced my experience so much. And now for my third child that I'm scheduled for September 26th for an induction, again, at the third time now, same thing. I asked to schedule an interpreter. I was scheduled last week for the 26th, and I asked the hospital directly to get me a live interpreter in person. They said, "No, can't do that. You have to wait till you're checked in." I said, "Come on. What if I have surgery in 2 weeks? Would you schedule an interpreter then?" "Yes, we do it in that case." Well, what's the difference? What is the difference in this case? Surgery or having a baby? So my question is, VRI is a great solution. It's great to have communication access. I'm grateful for that. But what if it's an emergency? The birthing experience itself, compared to an in-person interpreter, there's no comparison, really, as far as being able to have that full experience as a mother and giving birth and learning about what's going on at the moment. My question is, why do mothers have to struggle with getting an in-person interpreter? We're in 2023. Why is this still an issue? Why do I have to fight so hard to make sure that my birthing experience is just as good as a hearing person's experience with communication access, as far as that goes? That is my question to you, And thank you for listening.
Test, test. Hello. Hello, everyone. I'm Joline Gregory. I have a 2-month-old baby, as you can see. And he's a little bit colicky right now, so I just want to make sure everything's okay. He's a little grumpy, so this is my third child. I have 3 boys. And so I have 3 stories to tell you. I also have my note cards here with me, so bear with me, please. Okay, so my first birthing experience happened in 2015. I was pregnant in 2014. I had 2 different doctors for my first pregnancy. My first doctor I would see weekly or every few weeks. I'd have an appointment the first 10 weeks just to make sure that I was actually pregnant. And I wanted to get an interpreter scheduled, and they said, "Yeah, no, I'm sorry. You could, I don't think so." And I said, "Well, for doctor's appointments, they generally provide interpreters if you request them." So I finally got them to provide an interpreter. I went to my appointment. The interpreter showed up. They did not show up. The receptionist said, "Oh, one was never scheduled." And I said, "Fine, I'll just go ahead with paper and pen because I want to know about my baby. Is my baby healthy? Is the heartbeat going okay? It's 10 weeks. This is my first pregnancy." My husband, or boyfriend at the time, who's my husband now, went with me. We are both deaf. We come from a deaf family. Trudaline's my sister, so we have a very big deaf family, and we've grown up as American Sign Language is our first language. So interpreters are important to us. So my husband and I went to the doctor's office, tried to get by with paper and pen, told me everything's doing fine, come back in a month. I said, all right, how about an ultrasound? We're going to give you the opportunity to talk about, I feel like I didn't have the opportunity to talk, and at that point and ask any question, they just said, come back again. So remember, this was my first pregnancy, first-time mom. So I went through that with my first doctor, kind of a struggle. So that was kind of like my sweet test, my glucose test. Nobody likes the glucose test. It's nauseating. Then I got the results from that, and they said, "Yep, you're good. No problems, no diabetes." And I said, "Great, no diabetes." But then I still struggled with the doctor because of the communication issues. So I went with a different doctor at a different hospital. So that was about at 20 weeks, 24 weeks pregnancy, thereabouts. And at 30 weeks, I finally saw the doctor at 30 weeks in the new place, new facility, and got my medical records transferred over. And they said, "You know that you have gestational diabetes?" And I said, "No, I don't. I was told I don't." And they said, "Yes, you do." I said, "Well, why didn't my previous doctor tell me?" So they showed me the results, and sure enough, I did. That was a 3-hour test. They said, "Yeah, you have gestational diabetes." So that was kind of confusing to me because I thought we had this conversation. Now, my second doctor at the other facility I was very fortunate at the time because I was going to college at ASU, and one of my friends was an interpreter there who was very supportive about me getting equal access. And they told me that you know the rules about VRI. And I said, "No, I don't. There are rules?" And they said, "Yes. If they failed 3 times at the hospital to get VRI services working, that they should have to get you an in-person interpreter." So that friend taught me that, and that was great news. So I went to the hospital and I said, "Hey, we've tried 3 times. You need to get me an in-person interpreter." So I did. I had an interpreter for the rest of my pregnancy. I was also scheduled for an induction with my first child because I had gestational diabetes and also the size of the baby. So the baby would be born about a week and a half early. So I went to triage. The nurse said, "We're going to give you some medication and a balloon in, and then I'm going to send you home." I said, "Send me home?" But I thought I'd be staying in the hospital because of the induction. They said, "No, new policy started yesterday. You're going to go home." I'm like, how convenient. Okay, so you put in this medication, then I go home and I wait all afternoon, like 4 times. I'm back and forth to the hospital with this just to get the induction. But by the 4th time, the medication didn't work. And they said, "Well, you have 2 options. You could either do the balloon at that point." Sorry, the first thing was the medication. The second was the balloon, and I'm sure you're all familiar with that. So by that time I was done. I want that baby out now. And they said, "Okay, great. We're going to go ahead with the balloon catheter, and we're going to now keep in mind this entire time during the day of this, I had no interpreter, no, not even VRI. Nothing was afforded to me." And they said, "Don't worry, it's only going to be a couple 15 minutes, then you'll be home again." And I said, "Okay." So by 8 p.m., they put in that balloon catheter with no pain medication. I was in so much pain. I couldn't even breathe. I was gasping for air, and my husband didn't know what to do to help me. I was in so much pain. I was at 1 centimeter and then reached 4 centimeters immediately. And then the nurse said, "Are you in pain?" I said, "Yes, I'm in a great deal of pain." And I told them, I said, "I can read lips, however, only a little bit. So if you can give me pain medication now." And the nurse said, I don't know, something, came up to me and told me her name. And I said, "Okay, whatever, just give me the pain medication." Gave me the name of the medication, which I didn't know. I ended up taking it. And said, "You're going to go home with the balloon catheter. Remember it, that was in there." And they said, "You're going to go home now." And I said, "Go home?" And she said, "Yes, go home." So I went home with a balloon catheter and a medication. I don't know what I took. I got home. I went to the bathroom, and it came right out in the toilet. It came out, and there was blood everywhere. So I said, "Okay, I am calling the doctor or the emergency." And they said, "Oh, that's okay. Stay home. Just go to sleep." I said, "Okay." So I slept and woke up in the middle of the night in so much pain. I was actually in labor. I was confused. I felt like I was hallucinating. I was confused. I was so confused. I told my husband, I says, "I think I'm in labor, but I'm not sure. I mean, I just saw my grandmother who has passed away, and so I believe I'm hallucinating." So I was like, "What is my grandmother doing in my bed? I mean, I can't even breathe." I was in the shower. I'm trying to see my grandmother there in the shower with me. So that's how bad the hallucinations were. And I told my husband, my grandmother's here, and he said, she's gone, she's passed away. I said, I know. All right, we're taking you to the hospital. And the rest of that, I was in a daze. So they got VRI started when I got there, and not till the morning did I have an interpreter. But it was such a bad interpreter. Bad reception skills, could not understand me. I didn't know what they were saying. I kept having to ask them to repeat. It was so frustrating. Then they changed to a different interpreter. The interpreter I had, who was my friend, whom I loved and adored. And they interpreted everything for me. They did a great job. And after that, everything had gotten so much better. Now, the second baby. And the aftercare, also I had a live interpreter because I had to fight for it. And my second pregnancy, the doctor's visits and so forth, I had no interpreter. At that point, I was done. I was done trying to fight just for my rights to get an interpreter because it was just an appointment at that time. And I'd have to wait and wait for them to try to give me an interpreter. I said, I need this for my health care now. And I just had to write back and forth because I wasn't going to wait any longer. My second birth was not in an induction. I started labor. So I went to the hospital in the middle of the night, probably around 3 in the morning. I was in a great deal of pain again. I was telling them I was in labor, and they said, well, we need to check to see how much you're dilated. You're only dilated 3 centimeters. And I said, okay, well, they said, we're not sure if you're really in labor. Well, let's wait like 30 minutes. Why don't you walk around for a while? I'm like, all right. Still, again, no interpreter while they're telling me this. So I'm walking around the halls in a great deal of pain. And I'm asking them to hurry, and then can you put me in triage or something? Because they weren't doing anything at that point. So they checked me after 30 minutes, and they said, okay, you're at 4 centimeters now. So we're going to admit you now. We're going to put in an IV, and la-da-da, take some time. The nurse didn't seem very serious. They weren't taking me seriously, that's for sure. With all that pain I was in, I was screaming and crying and shaking and begging for medication. I was begging for pain medication, please give me something. 30 minutes after checking me at 4 centimeters, I gave birth. In triage, they didn't even put me in a room. They didn't even put an IV by that point. I was writhing around on the bed in pain, crying, and the nurse was surprised because the nurse actually had the audacity to ask my husband, what's wrong with her? I'm in pain is what's wrong with me. I was shaking, and the nurse asked, why is she shaking? To my husband. So it was very defeating, it was. And in that moment, I said it, I was done. I opened up the curtain, I said, my baby's head's right here. And they were shocked, and they said, the baby is coming. I was fed up. I was mad. There was no interpreter for the entire experience, not even VRI. Well, there was VRI. I couldn't see it because I was in so much pain. It kept freezing. I was ready to punch the screen on the VRI, on that Apple iPad, fancy iPad, but I was ready to destroy it right then because no one was helping me. My husband didn't know what to do because the nurse kept making him feel uncertain about what to do. And I didn't even believe I was in labor, even though the monitor was showing it. The baby came out, though. Believe me now. And then the aftercare and everything else was fine. I had an interpreter that kept coming to me and attending to me. My third pregnancy, this baby here. My first 2 babies were here in Arizona. My third baby was in West Virginia. I gave birth in West Virginia to my third boy. I had no interpreter the entire pregnancy because it was a very small town. And like I said, I was done. I was done fighting and struggling just to get equal access. I was done. I was tired. I'm 32. I just wanted to get it over with. And I felt like I had enough knowledge by now to know what to do with my pregnancy. I mean, I'm a mother, right? So I went through the entire pregnancy without an interpreter or anything like that. And I found out that he has some developmental issues with his kidneys that became more of a high-risk pregnancy then. So all through the pregnancy, we did ultrasounds weekly, and about 45-minute drive from my home is where I'd have to go every week to get an ultrasound and then go back home. So this was an ongoing thing. And then when it was time for delivery, I went to the hospital, and I thought that maybe I was in labor, because my second is 6 now, and so that was a 6-year gap, so I kind of forgot a lot about what labor was like. I'm like, am I in labor? I'm not sure. So I went to go check. Sure enough, I was. I was in pre-labor, so they just said, we're just going to keep you here. You live too far. Why don't you just stay? So I said, great. I spent the night there, and then the next morning, about 10, I started actual contractions. Very strong contractions. And then the nurse went to check on me, and I was dilating slowly. By the time I was about 130 or so, 120, they checked me and said, you're at 4 centimeters still. I said, well, I'd like an epidural. I'm really tired, and I need to sleep. And they said they would do that. They'd go get the doctor. And the doctor's busy, as it turns out. He's taking care of another labor. So in that time, my baby was born. Just like that. So a very fast birth. After that, the doctor was great, very clear, worked with me, and the nurse was very nice, very friendly, very communicative. I had VRI the whole way through in my room. They left it there. So we would use that for the important discussions when people would come in. Otherwise, I'd turn it off. That was my 3 sons. Those are my stories of my experiences. Thanks.
We can now take some questions if you want. If anyone has any.
Again. Thank you very much for that. If we are in a situation where we don't have, okay, rewind. As a floor nurse, I want to provide the best care possible. So if my hospital does not provide an interpreter and my VRI is not working as usual, how can I best help you?
As you can see, our stories are all very different. I don't speak. I don't lip read. Joline can speak for herself. She lip reads some. She's very assertive. Our situations are completely different. So it really depends on your patient. It's a very good question. So I suggest you ask your patient, what are you most comfortable with? That's the best thing you can do for them. That's what I would tell you. And I know that your patient would appreciate that.
I also want to add that not providing an interpreter or them denying an interpreter, denying a VRI, all of that is illegal. Your hospital can get in so much trouble for that if the patient chooses to go out with the hospital. It is very illegal. So try to advocate as much as you can. Go higher and higher and higher and higher if you have to. We deserve to know all communication as much. It's just like you guys. We deserve to know everything. That's all.
One thing I would like to add as well is that, yes, ask your patient, absolutely. Don't ask, can you read lips? It's just, oh my gosh, I'm so tired of that question. If we can read lips, maybe we can, but you're only going to get at most 10% off the lips, what a person's saying. And it is not a solution for communication. If you ask, can you read lips, what I'll usually tell people is, no, I can't. Nope. But I can read lips pretty well, actually. But I'm going to tell you I can't because I don't trust it, nor should I. Because people have accents, and with accents, your lips move differently, completely differently. And we can tell if you have an accent when we're trying to lip read you. I can't hear it, but I see your lips moving differently, so I know you've probably got an accent. So don't ask if you can read lips. It's just not surefire. So you write on a piece of paper, you write on a whiteboard, whatever you can. And the number one question, can you read? Please don't ask people that. Please don't ask that.
Yeah, that happens quite often.
Yeah, we've all had that experience. Like, can you read? Can you write? You just asked. I just asked you to write. Why would I not ask you to write if I can't read? I don't know. Can I? So, anyway. Try another question if you'd like.
That's a great question, though. Thank you.
This is Carmen. I can add to that a little. One thing that's really important in planning what should you be doing is checking before you have a deaf patient. Do we have a policy for communication? And oftentimes what happens if a hospital has a contract with an interpreting agency, a lot of times they stop at just having one agency on contract. You should have more than one agency on contract so you can be able to demonstrate your due diligence to provide a particularly in-person interpreter. Have more than one contract so that you can prove your due diligence in providing equal access to effective communication.
So I was blessed in the last couple of months, actually it's been in the last 30 days, with meeting a deaf patient for the first time early in her pregnancy. I did not have a chance to review her chart before walking into the room, and nobody really informed me that she was deaf. I found out when I got in the room. She had with her her husband, who was also deaf. He could speak, but she was not able to, to make noise with her mouth as far as a speech pattern. What I chose to do at that point was not to go to a pen and pad. I actually took the laptop that I had and started writing on the laptop and typing. And, first question was, is this comfortable for you? We worked it out very well. I felt very awkward, but we had a very good visit. It was a very long visit. It was an initial prenatal visit, and I did a lot of teaching and education. I think it lasted probably 2.5, almost 3 hours. So the thing I want to explain to you as a provider, because I am in a very rural area, I am new in that rural area, and so I don't really know exactly, do we have VRI or whatever? Do we even have the ability to have an interpreter for our patients? I don't think that we do. So that's really the only alternative that I saw at that moment in time. And I guess one of the points is that there's sometimes when you may be found in the situation and you may not have the access to an interpreter, but try to be very intuitive with the patient, and then don't just turn the patient away because it's difficult. I had to actually run back and different things to accommodate all the patients for that afternoon, but also take into consideration that if you don't have access to these interpreters, that the visit's going to take double the time that it should normally take, and don't rush with the patient at this point. That's just all I wanted to say. Thank you.
I also want to add patience. Patience is key. And wait for turn taking, because that is going to take extra time, like you said. We can see and tell if you are in a rush, which means that you are not patient. When you're in a rush, I feel that there's no connection, and you don't care so much. So you don't care how we feel, but patience is key.
I'd like to add to that. Your experience was great because you took the time to interact with that patient and to provide the care. Oftentimes, I'll admit it myself that I'm frustrated with the system. So my approach with doctors or nurses who say no, and we'll see you next time, I just shut them down, or I shut down and give them an attitude, or I get mad or combative and want to fight, type of thing. So, but if you're willing to work with us, we don't have this, but what else can we do for you? That's a huge difference. And you see what an impact it makes as far as the relationship with your patients go. You're willing to do this for me, I'm willing to do that for you. Like you were just saying, there's no interpreters available, or you're willing to go to a laptop and figure out what would work and do what it takes for your patients. So that really makes a big impact when interacting with your patients. Whenever I get that horrible bedside care, I have an attitude.
I'm guilty of that too. Yep.
I'm not deaf, and first person.
I'm more of a bitch than she is, actually.
No.
No, I know you're not deaf. I know you're not deaf, but you interacted with the deaf patients. Right?
I'm not deaf, but if the first word out of a person's mouth, even if they're my provider, my nurse, or whatever, if the first word is no, then I know they're not the right provider for me. and I walk away, because that shouldn't be what you present to the patient right off the bat. The first thing you should present to the patient is, this is what I can do, and how else can I help you? And then you find out where you might have to say, well, I'm not sure I can do that, but never no right off the bat.
Right. And oftentimes we do get that. It's no. But if you spend that time to interact with that patient, it'll give you time to research some information, other solutions, and it'll give you time to figure out what you can do to establish that rapport with the patient. Over here.
Do we have a? Where? Oh, right in front of me.
Thank you so much for sharing your stories. All three were very impactful. I have a question regarding the quality of the interpreters. So one, when the VRI is the only method available, have you found that to be a high quality interpreting services for you?
Can you repeat that question? Her question is, she was saying, using VRI, are the interpreters typically high quality? I would say no. And Lexi's saying that's a mixed bag. Trudy's saying it's just like anything else. You either have, good or bad. You have good interpreters, bad interpreters, just like when you have in-person interpreters. The quality does vary.
With interpreting quality, attitude is what's important, really.
Lexi's saying it's just like doctors and bedside manners. You have good doctors and bad doctors as far as that goes. So it's really the same thing.
Also, just to let you know, you as providers, your tone of voice is an interpretation as well. Your tone is interpreted, okay? So we can understand what kind of tone you're using. So if you're coming off with a terrible attitude, we can tell, because our interpreter is going to let us know. And I'm going to give you an attitude back without problem. I will let you know that. So tone is so important.
Thank you. Another question to that. If you had an in-person interpreter that was not providing quality interpreting, would you feel comfortable saying that the interpretation?
For the most part, I would say no. I will send them away. Go ahead, bye, you're done. Another time, I might just talk with them and say, well, I'll just take it. You know what? It's just, but it shouldn't happen. It really shouldn't happen.
Like so that we would know how to help you.
Right. The agency usually has documentation or notes. If I have prior experience with this interpreter, if I wasn't satisfied, I let them know. That way they can keep a record of that not to send that interpreter. They usually will send out a request for interpreters, and if there's, we have sort of a notes on that, whether or not we should send that interpreter to this client. So patients have to advocate for themselves. The agencies also have to be diligent. Unfortunately, oftentimes patients will just grin and bear it. So,
yeah, sometimes it's like better than nothing. But, if it's a lousy interpreter, sometimes it's better than nothing. You just kind of have to make do sometimes. But at the same time, like Trudaline says, there are some specific interpreters we like to request. I have a couple preferred interpreters that I will put out to the agency and say, I'd like one of these three interpreters, if you will. And they will do their best to try to provide them. And then we'd kind of see if other interpreters are available if those three are not. But most patients don't know that. They don't know that they can document a preference until the agency until they then put their own names down. And sometimes they'll just send the interpreter. But a lot of patients, like I say, don't know that they can have a preference.
I actually did have one experience I want to add. I had one experience one time where the interpreter was so bad. I was like, can you please get another interpreter? This specific office did not have the VRI, and they could not get another interpreter in right away. And they're like, okay, well, maybe we can reschedule your appointment. I'm like, this appointment had already been rescheduled twice, by the way. And the next appointment opened was 4 or 6 weeks after that. I'm like, no. So I stopped there to just go ahead, pen and paper, until somebody brought out a laptop to type on and stuff. But I know most of the time you guys can't have electronic or your phones out and stuff. But now I think it's a little bit more accepting. You can use your phone to type on what you want to say, or your laptop is better than pen and paper. But we usually say pen and paper because most of the time your policy is to not have your phones out. So we understand that. But yeah, I've had experience there to where they just wanted to reschedule because the interpreter is so bad or the interpreter didn't show up.
Where can you find a listing of the rules that help you know what is legal and required for interpretation?
Carmen Green.
Like, is there a
Carmen Green.
website or you can send them?
acdhh.org, and you'll find some information there. And we've also worked with ASHOP, and they'll be providing some of those resources that we've talked about. So, but you can always reach out to our agency on the website or by just giving us a call.
Do we have any other questions?
I thought someone had a question over here.
Okay, well, let's give you a round of applause.
Thank you so much for inviting us.
Thank you.
Thank you, Joline, Lexi, and Trudaline. That was very powerful, and thank you for raising that awareness and shedding a new perspective. Thank you.